yenze nazwa ketra n'emyaka 18 olubuto nalufuna mu 2023 okutegeera nti ndi lubuto kyambira kale namala kulanga embeera zange zikyuse then nesalawo nekibiriko ndabe nagenda okwekirira nga kituufu ndi lubuto.
In Uganda, 1 in every 3 adolescent girls is either pregnant or having a baby. Teenage pregnancies account for 28% of all maternal deaths, while maternal mortality still stands at 316 deaths per 100,000 live births.
Only if I'm to focus at last month, we got 25 young people who tested pregnant and there were unwanted pregnancies. So averagely, we get like 5 young girls who come out to be positive. And on a sad note, among those 25 we got, actually 2 of them were only 14 years old.
Uganda is among the 36 GFF-supported countries eligible to receive GFF funding. This fund is meant to implement the Uganda Reproductive, Maternal and Health Improvement Project aimed at improving the health outcomes of mothers and children in Uganda between 2016 and 2021.
First of all, because you know, pregnancy is one thing someone cannot hide away, because as it grows, it protrudes. So one of the biggest challenges that we've encountered with young mothers is they don't want to open up. They fear because, of course, you know, society, you're young, you're pregnant, so everyone at the back of their mind, they are condoning you. Now look at this young girl, she's pregnant, you know, she engaged in early sex. So we find that we get a challenge of those young people to freely open up to us.
Abasinga banenya okufuna olubuto amangu. Naye nali basina kyakola de bali banenya. Naye sina kyakola kuba lwali luze.
A civil society platform led by World Vision Uganda was created to bring together members of civil society and different stakeholders to deliberate on GFF and RAMNAC interventions in Uganda, where different forums, including youth forums, were created to effectively engage and involve youth in GFF and RAMNAC country processes.
Around 2017, through an invitation from World Vision Uganda, that was still through our network called Girls Not Rights. And since then we've been working with them on a number of issues, especially around the budget and budget advocacy, especially around the needs of young people, especially girls, on girl empowerment and any teenage pregnancies, a number of things.
With teenage pregnancies, at the moment there's a lot that is being done as a country, Uganda, to prevent teenage pregnancies, but of course we need more effort. And one of the things that we need to focus on majorly is keeping girls in school. You know, looking at how do we scale up universal primary and secondary education for the girl child, but also how do we address the issues of gender-based violence in our communities. So this needs engaging the community, engaging the gatekeepers of our communities, not just the girl, but also how do we engage the boys and the men, because let's face it, those are the people that are responsible, you know, they play a part in you know, getting the girls pregnant, addressing the different vulnerabilities that put this adolescent girl at risk of getting pregnant, you know, and in most cases we look at the socio-economic vulnerabilities that they do have. Most of them, you know, go for cross-generational sex because they're looking for money. So how do we really empower them to be able to take them away from that risk?
Ebitongole ebimu ebijja mu community babuulirira abaana, abamu bajja ne bagaba condoms, abalala bwe bajja bakebera HIV ne bakansolinga, so nobeera ng'omanyi ku HIV ne batuulira ku sexual reproductive health rights, n'ebirala naye nga ebyo bye bisinga amakulu bye batugambako.
The youth have been engaged in GFF and Ramna country processes, including having a seat on the CS platform and a steering committee. With this engagement, a couple of tangible achievements have been realized ever since.
Young people have been very influential and pivotal to that progress. For example, we've seen very many young people advocating for quality, comprehensive and integrated sexual reproductive health services. We have been at the forefront of making noise, been at the forefront of demanding and doing social accountability to make sure that services in the various health centers are more friendly, more aligned and more tailored to young people.
Okwawula abavubuka n'abantu abakulu mu antinentu kiba kirungi kubanga abantu abakulu abamu kale sijjaga abantu bakulu bokka ne ba youth abamu bali judgment kale ba judgmentinga n'agamba kimuyinza okwesanga omukyala omukulu n'agamba ono omwana nga muto nnyo okufuna olubuto ate ng'akyogera owulira so kiba kikumalako emirembe oba tofiitingawo.
We have contributed to the body of knowledge and evidence as young people. We've done research, majorly youth-led research that has really brought out some of the major key issues affecting young people in terms of their access, demand and uptake of services.
Uganda has always had around 5 to 8% of the budget going to the health sector, knowing that Abuja Declaration recommends 15%. But this financial year, we had, I think, about 5.8%. So we need a lot of budget advocacy and a lot of information to the young people to know that this is their cause and they should be a part of it.
Young people must be supported at the lower level to get on ground and understand the challenges they face. Speaking about the result-based financing model that government of Uganda is using to achieve the GFF goals, the key targets set within the RMNCH sharpened plan.
The sharpened plan that ended actually in 2020, we didn't see a lot of adolescents and young people actually taking part in the monitoring process, holding our leaders accountable, and the different stakeholders, of course. So for me, the major recommendation is how do we have clear mechanisms of engaging adolescents and young people in these big processes.